Hello and welcome to Listen.Up.People, a podcast of the USC Suzanne Dworak-Peck School of Social Work. I'm Dr. Eric Rice, Professor and Associate Dean for Research. My guests today are two prolific researchers who are dedicated to advancing the health and well-being of the LGBT population. Overall, LGBT individuals experience significantly higher rates of health, mental health, and behavioral health problems than their heterosexual peers. Yet research on these disparities is under-researched and lacking. The current political climate has raised questions around there being an even less welcoming environment for research around these issues. But my guests today have a vision of a world that promotes the physical, emotional, and social well-being of all people, regardless of their sexual orientation or gender identity. So let me introduce my two colleagues, Associate Professor Dr. John Blosnich, whose expertise focuses on health disparities related to sexual orientation and gender identity, and Assistant Professor Dr. Gabriel Robles, who focuses his research on healthcare access and well-being of sexual and gender minorities. Welcome, both of you.
Thanks.
Thank you.
Glad you could spend some time with me here today and with our listeners. I want to start with something a little more perhaps personal, rather than just jumping right into your research, which is something that I've been trying to ask folks in these podcasts, which is what got you interested in doing this kind of research? Did you have a moment in your life or an experience that made you think, oh, I have to work on, with this population on these issues? Maybe we'll turn to John first. Was there a white light moment for you in this world of research?
I think for me, it's clearly a personal thing too. But for me, it came when I was doing my training in public health and how I kind of found my way to public health. I knew I always want to be an advocate, but I knew I was not the person to be standing in front of any sort of decision-making group to try to make a plea. I'm more of a behind the scenes advocate. So I was like, to the more polished people who speak real well, I was like, tell me what you need to know, and I will find the data, find the studies for it, or I will do them to give you that information to take forward. So, I kind of found a place to hone my advocacy in research. Yeah, and that's kind of how I.
That's great. That's great. Gabriel, how about you? Was there a moment that you said, "Oh, this is what I want to do with my career"?
Yeah, so it started I had just graduated from undergrad. So I was in Long Beach and I was working at the Y. I was working with kids, and the kids, at certain times of it's afternoon, after school hours, they go out and have structured kind of recess. And so I stayed behind and I cleaned up the office. There's a bunch of toys everywhere.
Mhm.
One of the Y staff brings in a kid saying, "Oh, he's not feeling well. Can he, sit in here while they have recess?" So I said, "Yes, but I'm going to be cleaning. If that's okay, you can help me." And he said, "Oh, I'll just watch." And so I was cleaning up. I had a bunch of toys. I put on, a fake crown and like some beads just because I wanted to, carry it all at once. And the kid comes up to me and asks, "You like to play princess? Can we do that?" And I said, "Oh, yeah, I like to play princess. It doesn't matter as long as, I'm having fun. That's all I care about." And that's when I knew that there was something happening like with well-being and like these kids. So I wanted to kind of explore that a little more.
How old is this kid?
I believe he was in either kindergarten or first grade. I don't
Oh,
exactly
wow.
remember. Yeah.
That's great. Can I play princess? Well, speaking of well-being, I know both of you are really invested in this. I mean, John, you have been doing some really, I guess it's nice to start with a story about a kid who's making Gabriel smile, because I think your stories tend to get a bit darker, a bit faster. But but I know that you're doing some really groundbreaking work on sexual orientation and gender identity that is buried within mortality surveillance data. So I mean, not to be a downer, but you're doing some really groundbreaking work. You want to talk to us a little bit about how you got into that and what sort of work you're doing in that space?
Yeah, absolutely. I don't mind dimming a room. I seem to do that every time I walk into one. So, what happens when we don't have well-being in a community um, is that we know that that doesn't bode well to thriving or survival. And so we have a lot of research that focuses on the increased risk profiles that happen for people who are sexual and gender minorities. Increased rates of smoking, substance use, suicidal ideation, suicide attempts, a lot of health risks there, but we don't know a lot about the ultimate outcome in public health, which is mortality. So one of the best ways to keep populations alive is to learn about what's killing them. It lets you focus your energies and your interventions on, what are the priorities that are actually limiting people's lives. We don't have that for LGBT populations because we don't have that information about mortality in terms of sexual orientation and gender identity. You could look up and know what are the top 10 leading causes of death for someone based on race, ethnicity, based on sex. I mean, hell, even where they live, we could generate top 10 leading causes of death based on zip code. But we don't have that for sexual orientation and gender identity. And for those of us working in the suicide prevention space, it's a problem. If we don't have this ultimate outcome, we don't know how to really quantify the burden of disease, which is one of the key things that epidemiologists do. But we also cannot do the second thing, which is, how do we hatch prevention and how do we evaluate that it's actually working? If you don't have a benchmark, you can't tell if the program you launch has made a dent in that because you don't know it's gone up or gone down. You don't have a rate of death, so you can't evaluate your solution. So we started from scratch in a very dark place, which is where do these mortality data originate? And that is, with medical examiner and coroner's offices. Suicide death, specifically what I focus on my research on, they all go through coroner and medical examiner systems. And that's where we learn about the circumstances of how someone, died. They don't routinely gather information about sexual orientation and gender identity. So we hatched a plan to develop and test a training for death, specifically medical legal death investigators, and how to gather this information in the course of their investigations. So that's what we spent a couple of years doing that on a study that was funded from 2020 to 2022. We trained death investigators in LA County and in the state of Utah. And along the way, learned about from these investigators, how do we edit this training, what information was left out that they need to know, what elements of their job need to be represented to increase the credibility of this kind of a training. So it was a really fascinating education in how I became partially a workforce trainer when I never thought I would be, because I always envisioned myself as a kind of a data jockey analyst kind of person. So yeah, that's that project.
It's an interesting change of career paths to go from being somebody who runs statistical models to somebody who's training people to do death investigations. Though I would certainly not think of those as one leading to the other in a linear path.
5 years earlier, if the fortune teller had told me I would have been there, I would have demanded my money back. And so behold, it came true.
It sounds like a really exciting thing to do, though. I mean, before I ask Gabriel a question, I want to just have one quick follow-up question with you about this, which is, how was this received? Especially, I'm thinking about in Utah, where I think of that as a much more conservative state than California and death investigators in Los Angeles, and just thinking about what was it like to work with people, asking them to now be probing about people's sexual and gender identity when they had not been doing that before.
Yeah, for sure. I think the main thing about this was this was not political work. This was about the work of getting data that's important for a public health end. The death investigators, their jobs, they have one of the hardest jobs on earth. I shadowed death investigators here in LA County. They go to scenes that are grisly and grim, to put it nicely. Sometimes these scenes are literally unstable. And their job is to recover and process the body, document evidence at the scene, and talk to next of kin.
Wow.
So this is not a job for the lighthearted, but this is where these public health data start. And not enough of us understand. I think a lot of us don't have appreciation for it because we just didn't know. And so their jobs are hard, and they ask people very personal questions. Next of kin, sometimes really personal things that sometimes next of kin didn't know. And they're delivering this to a person who may have just found out that this investigator is the one who's alerting them that their loved one has passed away. So in that regard, there's really no question that's off the table for them. They're already delivering the worst news possible. There's very little that they can say to somebody that is going to be worse than the news they just delivered. The challenge was their conversation. They are not data collectors in a traditional epi sense of I have a survey and I'm going to run through these questions with you.
Sure, sure,
They have
sure.
to stoke a conversation. So it's, running through this with them to identify ways that this can be brought into the conversation extremely naturally. It's just they need to know about the concepts and how to introduce them. So I think once we talked about that with them and ran through it with them and established that they are crucial to public health, I think that got people on a at a place where they understood the importance of the work and they understood that it was feasible, and that this was not about any one singular person's beliefs about what they thought about gay people, what they thought about trans people. It was rooted in we have a health problem and we need these data to inform that. And you are in a very unique space to do that. They're tough questions, but that's the name of your gig is tough questions and tough news.
Yeah, yeah.
So yeah, it was
That's very cool.
just
That's
for
very
fun.
cool. I imagine it was actually something fairly empowering for them in some regards as well, given the way you've described it. Gabriel, let me, as promised, maybe we can lighten things a little bit. But I know that you also deal with some very serious stuff though too. I don't mean to make light of in any way what you do. I know that you're very much interested in community cohesion, social support, and how it is that people are accessing healthcare, kind of born out of this experience of what's happening for folks, and how do we create well-being in these communities. Can you want to talk about what you've been working on recently?
Yeah. So one of the things that I like to talk about is, of course, as a field, we are to some extent we're well versed in kind of intersectionality, and as Kimberly Crenshaw, describes it, like these intersecting roads of oppression or the systemic forces that kind of interact and like reinforce each other. But with that, or along those lines, I also want to look at kind of how people belong to multiple communities,
Hmm.
and they're likely drawing from various strengths from each of the communities they belong to. I do a lot of my work with racialized minorities who are in the LGBTQ community, specifically Latino, gay, bisexual, and other queer men.
Hmm.
And so we're often kind of embedded, and I say we because I identify as part of that community. We're often embedded in, at least the Latino community. And so that community comes with lots of sources of strengths and, things that can help us be resilient in our daily lives. And some of us are also kind of connected to the LGBTQ, kind of broadly speaking. And that community kind of has this, history of advocacy, this history of kind of, being out there and in the front lines trying to, fight for what's right. And so, at people who belong to both communities, I think that we can kind of draw upon, various strengths and kind of build one kind of cohesive, life, or one cohesive community where we can kind of all, work together collectively.
Sure. I mean, are there challenges though there as well? I mean, I would imagine that there's some ways in which I don't know, the idealized, I think about kind of the archetypical, Latino man, and the sort of the stereotypes in the gay community. I mean, those things don't necessarily go as easily as the sort of the mutual strengths you were just talking about, right?
Right, exactly. So for example, I've done some work on, machismo. And
Okay.
so, people just report that, oh, if I'm going to be a part of the Latino community, I might not be as accepted as I would be if I were kind of interacting with people in the LGBTQ space.
Hmm.
And so that kind of leads us to like where's the work, and where do we need to do the work? Is it that we need to really make spaces that are, historically Latino more inclusive of LGBTQ, individuals? Or is it the inverse in which we're making, LGBTQ spaces more inclusive of, racialized minorities? My answer is always like, we need to be doing the work, in tandem together at the same time,
Sure.
because we can't kind of prioritize one experience over the other, because it may be that today, on this specific day, I'm interacting with the Latino community, but it may be later on tonight, I'm interacting with the LGBTQ community. So there really isn't this, separate or the separation that we kind of find in research or in these data sets, it's very complex and it's kind of together.
Yeah, yeah. I mean, it's interesting you say that the separation in these data sets, right? I think, I mean, maybe even in the data, there's not necessarily the separation. We just like to have these very separate concepts in research dialogues. And at least in my experience, I don't think that that necessarily, as you suggest, jives with people's reality, right? I mean, people's reality is much more nuanced, complex. It's fluid. It moves, changes from moment to moment during the day sometimes, and I think that that's doesn't necessarily lend itself to statistical models in the easiest of ways, but it certainly is the reality of our lives. So, John had mentioned that his focus being on suicide and suicide prevention. What are some of the issues for this population of Latino, uh, you know, LGBTQ men that you're interested in working on?
So I primarily, as we're talking about research, researchers often ask, well, what's the outcome of interest? And my outcome of interest
Mhm.
would be kind of accessing healthcare services.
Okay.
There's a history in the LGBTQ space that, when we look at healthcare access, we look at sexual healthcare access. And I do
Okay.
agree
Sure.
that's very important. That's extremely important. It's a salient need and we need that. I also think that we can think broader than that. We can start to think about how we can start to access preventative services, primary care services, and
Mhm.
how can we kind of integrate this idea of being inclusive to both Latino and LGBTQ people in one space. And I think the clinic could be a space where we can do that, or we can begin that work and ultimately, make communities, I guess, healthier again. I know, right? Um,
Yeah. I think the focus, I've certainly done some research on within the work that I've done with homeless young adults around some of the issues that face LGBT communities within that space. And you're right. I mean, oftentimes some of the research and even advocacy work was around sexual health, and that's only part of people's lives. And honestly, when I do work in those communities, those young people are much more concerned about their their safety for the night, or they're concerned about where they're going to get something to eat. They're maybe, if they've got a health concern, it's more about their mental health maybe, or even the fact that they've got an infection. They're and by infection I don't mean like a sexually transmitted infection. I mean they like cut themselves and now they've got a big infected boil on their leg, and they're not really in sexual health is an important thing, which I think maybe easily tracks on to those communities. But people are so much more than that. That's one of the things I love about your research and John's too, is that it's a much more holistic vision of people. It's not just trying to pigeonhole sexual and gender minority folks around their sex lives. I mean, I think that that's so that's so limiting in some respects, and thinking about why do people live healthy, thriving lives, or why do people end their lives when they're not having health and thriving is really fascinating. I want to touch on the way in which some of the recent federal decisions around research initiatives have impacted research. And I know that, John, you had a grant that was focused on parents who had a child who was a sexual minority that had come out, and about how they were coping with that experience that was defunded and then perhaps reinstated. And I'm kind of wondering, if you can share with folks a little bit about what that research was about, why you thought it was important, and also maybe some of your thoughts about, the future of that kind of work.
Yeah, absolutely. So the grant was focused on parents, like you said, parents who had a child come out to them about sexual orientation. This project did not involve gender identity. It was terminated by the NIH, citing that it was focused on gender identity, which was patently false. That was not part of the grant at all. Um, but the impetus for the grant was really taking an upstream approach to suicide prevention for sexual minority youth, who we know have very high rates of suicidal ideation and attempts. But because what I talked about in our other project, we don't have any idea if suicide deaths are greater in this group. But we know enough to know that ideation and attempt are massive problems for youth who identify as sexual minority. But we wanted to take a family systems approach because research consistently demonstrates that family rejection is a major predictor of mental distress
Mhm.
among sexual and or sexual minority youth. Naturally we're like, we want to know more about parents. So when a kid comes out, parents are a cornerstone of a family unit, and parents need to figure out how they sort of guide and manage their families. And when a kid comes out, that's a family system change for sure.
Mhm.
But we don't know what parents need or how they navigate that family system change. The lore is kind of, well, if a parent doesn't automatically sign up to be the marshal of the pride parade, they're awful, right? Parents have just love
Mhm.
their kids unconditionally, and many parents do. But parents are afraid for their children for, ironically, the very reasons why our grant was terminated. A kid who comes out, for a parent who's not a sexual minority, their understanding is their kid's going to have a very different time in life, which frankly is going to be a tougher time in life than if their kid was straight. And a lot of parents react poorly because they're just afraid for their child. But the literature does not know where parents go for help, what they consult. Do they just Google what to do? Did they go visit clergy, religious leaders, medical professionals? Do they not talk about it at all? And what do they need to get through this? Because most families will get through this. But that's what we wanted to focus on, was surveying and interviewing parents. And this is not an easy group to find.
I
Where do
bet.
folks who are going to, who are parents of a person who identifies as a sexual gender minority person, right? So that this research is really digging into how do we find them, and when we find them, we have a lot of questions we need to ask both in a survey and then getting more detailed information from them from folks who would agree to do an interview with us. So that grant was terminated. It was reinstated in July. We've been working on it, resuming work on it as best we can with that kind of a disruption to it. Uh,
Sure.
but yeah, so that's where that project currently stands.
I want to get really nerdy with you for just a second here. Forgive me for this, but I can't help myself. When you said, how do we find these parents? It makes me think that I guess my assumption would be that the two places you might find parents are in some space where they're being a very loud positive advocate for their child that's come out, or perhaps they're being a very loud decrier of their child's coming out. And I wonder, what you're how you're trying to deal with, not just trying to find the extreme cases, right? Because I think that those are the visible folks, the people that are very upset about it, or the people that are very welcoming or proud of it. And I would imagine that there's a lot in between, right?
Yeah,
Maybe.
there is, and we really want the between, right? You don't want the outliers necessarily. I mean, they'll be there. But our main component is, and this is sort of survey recruitment nightmare slash experiment 101, was being able to target large enough samples where we could find the baseline inclusion criteria is, are you a parent?
Oh,
Right?
wow.
The stepwise thing of, are you a parent? And then, you know, do you have a child who identifies or is coming? So it's sort of, we're starting at that umbrella level trying to find them. So we're using very large level recruitment avenues. So Research Match is a resource developed by NIH of individuals who have opted in to basically
Mm.
volunteering for research projects. The inclusion criteria is not that you want to do this because of any number of things in your characteristics that make you who you are. It's just you have an interest in being in research, and then you get this kind of newsletter that shows you all these different opportunities, and you can opt into it.
Gabriel, I'm wondering if you wanted to talk a little bit about some of the sampling or some of the research strategies that you've been employing recently. Because I think it's really interesting to hear from John about the death investigators and about trying to reach these samples. But I mean, where have you been targeting your the actual time that you spend in the day working with these folks recently?
So one of the things that I want to, I guess be clear and give credit to is that I work with a group of kind of not like men, like gay, bisexual, and other queer men, kind of throughout the United States.
Hmm.
When I first started here at USC, I was trying to create some type of community group or advisory group, and so I kind of recruited on social media. Is anybody willing to, work with me? We can work on projects together. And so several men did. They signed up. They emailed me, and they were like, "Oh yeah, I'm interested in, like, giving. I'll give you some of my thoughts and like where we can go as kind of as a field. And so one thing that I personally implemented first was this social media kind of recruitment. Let's recruit, Latino gay men on social media. And things became a little complex once the election happened, because
Mm,
then nobody was kind of signing up. And then it was
mm,
immediately like, I don't want to give up or, let you know what some of my demographic information is. And so I went back to the community advisory group that, we formed, and they were like, yeah, we are literally, this is happening in our communities. This is happening at our clinics, at our CBOs. Nobody wants to, come in for any service. Nobody wants to come in and fill out any intake form.
wow.
And so one of the things that they recommended, and I'm really grateful that they did, is that I work with community organizations directly, because
Sure.
each community organization is kind of finding out, is tailoring the recruitment methods that is good and appropriate for their own community. And so that's kind of how I've been working with these participants of the studies, is let me connect with organizations throughout the United States.
Mm,
One of the things that we saw was, depending on which community you're in, some, Latino gay men are receiving all the services. But if you happen to be in a community that is not, where health isn't kind of at the forefront of their community, they may not
mhm.
be receiving services at all. I mean, it just depends on what their priorities are. And
Are these
so,
community organizations mostly health organizations, or are they mostly organizations for gay, bisexual, queer men?
they're for gay, bisexual, and queer men. They're
Okay.
specifically ones that are working with the Latino communities.
Oh, okay.
And so often, these organizations, they fill the gaps that the broader healthcare system is not meeting. And so
Okay.
what it means is that they integrate services. It's mental health services. It's, primary care services. It's, as we mentioned, it's sexual health services. Often they're just providing a space for kind of social well-being.
No, that's great. And I think the way that you just mentioned this community advisory board helping you think through this future of research, this is, I think, how I want to lead us out of this conversation, which is to ask both of you what you are envisioning over the next few years as being important avenues for research to work with the health and well-being of the communities that you each are a part of. So maybe I'll turn to you, John, first, and then end with you, Gabriel, about what you think is an important direction for the research to move in the next few years.
Yeah, I think for me, I'm still in this space of vital statistics, especially around mortality data, to really understand from my perspective, the toll of inequity on populations. And these mortality data are key. I think we see this happening. Well, I mean, the case in point, what's happening with maternal mortality in the country now in a post-Dobbs decision, America, where states that have banned abortion care are seeing increases in rates of maternal mortality. And that's
Mhm.
only known to us because we collect this information and we count this information at the time of death. And that is absolutely crucial to knowing again where interventions should be placed, but also holding people and policymakers accountable for decisions that they made. So I am all about finding ways to enhance our mortality information because I just think that is a bedrock of our public health. And it's if we don't have it inclusive of our communities, we're not understanding the full toll of what's going on.
So well put. Gabriel?
Along the lines with inclusivity, I think that the future of research in this area is how can we make every healthcare setting kind of inclusive to people, so that
Mm,
the burden isn't on the community member, on the queer man, to figure out, okay, if I need primary care services, let me see if I can find someone who can provide services that is specifically tailored to me. But if I want to go to a place, doesn't matter where it is, I should be able to do so and make sure that the staff and the healthcare providers are providing services that are not only scientifically sound, but that are socially and culturally appropriate. So I think that that's kind of where we're headed, something that's
That's
a little
great.
more integrated.
That's great. That's great. I certainly hope that both of your agendas are things which we pursue in the near future. I think they're both absolutely needed. And I just want to thank you, John and Gabriel, both for such a great discussion. So I hope that you will be willing to come back and share more with me in the future. I also want to commend the two of you on being in the center of research that is requiring people to be brave. And I really appreciate your bravery of doing work that you believe is important and scientifically relevant. And I wholeheartedly support you and believe in its importance and scientific relevance. So, in the meantime, if listeners are interested, they can check out more on our school's website where we have a lot of information about ongoing research. So, you can go to dworak-peck.usc.edu to learn more about all the work that's going on at our school around these topics. And if you have questions for our guests or for me about the show and you want to support the transformative research of our program, you can email us at listenuppeople at usc.edu. So that's listenuppeople at usc.edu. And just one more time, John and Gabriel, thank you so much for spending your time with me. And I hope our listeners enjoyed it as much as I did.